Hi guys, this is Christian here. I'm here with Mark and Joe. Uh, so we're here to basically go ahead and try our first case as an example of how to use the AI. And also, not that only that, it's more important to know how to talk to it, basically, how to chat with it so you can get the best results. And that's the reason that we have decided to record this kind of podcast style as we go live, basically, as we use the AI live. And then, that way, where to start, in a sense. Anything to add, Mark or Joe?
No, I
Oh,
don't think
if
so. I
you
think we can get started with the first case.
All right. Getting some kind of warning with Safari. But, like, if you want to start going there, right, we want to do chat.fastmedical.ai, right, as usual. Which state are we doing? Are we doing New Hampshire or Massachusetts?
well, we do one
Either
of
one.
each.
Yeah,
Yeah,
that
sure.
sounds good.
I mean, let's do Massachusetts with 911, right? We should, right?
Yeah, that sounds good.
Right. So
Sure.
I just increased the zoom on the screen for my desktop so it looks like a mobile, right? And you'll see this hamburger icon, we call it. Here's where you see all the conversations, and in the mobile it'll look like this. So this is where you create a new conversation, right? And then, so I'm gonna leave it up to you guys. So you can, I mean, Mark actually. Um,
All right. So the first scenario we're going to start with is going to be we're going to keep the scope on ALS just so we get the full breadth of this thing. And then our 911 scenario is the first one we're going to be doing in the state of Massachusetts. So the first 911 scenario that we've got, our first prompt is going to be I have a 5-year-old female patient. Unresponsive but breathing. Parents stated that she would not wake up this morning. Last night she went to bed with a rash after playing outside in the grass. And now her gaze is fixed to the left and her body is semi-rigid. Parents deny any past medical history. All right, and that's it. We'll go ahead and send that. It's important to remember, especially for your first prompt, your first query, whether it's a question or a statement, the more detail you have in it, the more detailed a response and the more narrow a response you're going to get. This thing is going to try to come up with a differential diagnosis. It's going to try to come up with critical first steps. And if your question or whatever you say to it first is going to be super broad, like if I just said, I have a 5-year-old female patient that has a gaze to the left and her body is semi-rigid, then the response that I would get from the AI would be super broad. And sometimes it's usable and sometimes it's not usable. So it's as a best practice, your first question should be as detailed as you can get it. And that will help the AI really hone in on an accurate differential diagnosis and some accurate critical first steps. And then from there, we can go on and we can add in little details. All right, so we've got something now. And let's take a look at it. So just like before, the first paragraph is going to be a summary of what we told it. So the second paragraph It acknowledges patient's presentation, raises a concern for altered mental status, possibly due to infectious etiology. So it could be infection, just as sepsis, maybe some sort of meningitis, maybe some sort of encephalitis. The rash may indicate a potential vector-borne illness. Sometimes we know kids can get, rashes, skin changes with infection. So right now, the second paragraph is all about sepsis. And it says sepsis should be highly suspected due to the patient's young age and the potential infection source. Maybe she got a cut. Who knows? Okay. Okay, so the third paragraph is giving us some interesting first steps, some of which does not apply to every ambulance service. Some ambulance services across the country can do blood cultures and different things like that. Definitely not a lumbar puncture. Okay. And the fourth paragraph, considering the patient's unresponsiveness and semi-rigid state. Okay, now it's going to go, okay, ABCs, airway management. The patient should be closely monitored for any signs of respiratory distress. Now it's telling us this because we haven't told them the status of their breathing, except that the patient is breathing. So again, that's where that detail comes into play. Let's go ahead and scroll down there, Christian. Okay, and so now in accordance with the ALS scope, here are your first recommended steps. Okay, so we don't have any vital signs yet, so this thing goes right to oxygen, okay? Administer oxygen, establish IV access, initiate fluid resuscitation as per the sepsis protocol. Your blood cultures, urine cultures, all those things. Initiate antibiotics and possible antiviral therapies. So we're going on based on infections. Notify the receiving hospital of suspected sepsis alert. Okay, and continuously monitor. So it gave us a nice 6-step, these are your critical first steps process. Let's go ahead and let's throw another prompt in there. And let's give it some vital signs. Let's say the patient's respiratory rate is 10, and the SpO2 is going to be 95% on room air. And now let's go ahead. The patient status has changed a little bit. Now patient has begun smacking her lips with full body convulsions. And the patient is also experiencing copious amounts of salivation. It's important to know at this point, obviously having worked this case, we know what it ended up being, but as let's say we can go ahead and send that. That's all I wanted to say. Let's say as a brand new medic, I wouldn't understand exactly what's going on yet. We're obviously suspecting seizure activity right off the bat, possible seizure activity, but we're not really sure why yet. We don't have all the data yet, and neither does the AI. So it's going to take this next bit of information, which honestly isn't even that detailed. If I was really working this in the field with the app, I would go ahead, if I could, and give it a full set of vital signs with blood pressure and everything, just as a best practice to get that most accurate response. Obviously, when we're working with it here live with you guys, we want to show you the full spectrum of what this thing can do with just a little bit of data. Yes, best practice says give it a lot of data, but it can work with a little bit. So again, we're going to recap. The first paragraph is just a summary, letting you know that the AI is paying attention to not only what you said, but what you have said for the entire conversation. Okay, so considering the query, conversation history, still recommends the following advanced interventions. Okay. Evaluation, step 2, high flow oxygen if you need it. Step 3, we're still, okay, obtain blood glucose levels. Okay, so now it's prompting the clinician here to go ahead and obtain some more testing. Okay, it needs some more data to come up with a really good, possible a better diagnosis. Initiate fluid resuscitation if they are hypovolemic. Still thinking sepsis. Antibiotics. Notify receiving hospital of sepsis alert. Consider still getting our cultures. Monitor their status. Prepare for any potential airway management. These are all critical steps here, pretty broad critical steps. Continuously assess the patient's neurological status. Okay, now let's ask it a question, because I'm kind of wondering here, could this be some sort of toxin? Could it, she was playing in the grass. Could this be some sort of organophosphate poisoning? So let's ask it, could this be from organophosphate poisoning? Maybe they just fertilized the grass. And this being a case that I worked about a year or two ago, I did eventually highly suspect some sort of fertilizer poisoning. I was never able to confirm whether or not that was the problem, but there was a lot of salivation. There was no bradycardia or anything like that, but there was the thing that keyed me in was the rash. I believe it was in the springtime, so it's possible the grass had just been fertilized. It was in the city at an apartment complex, so the residents wouldn't necessarily know that the grass had just been fertilized. So let's see what the AI says when we ask it, could this be from organophosphate poisoning? Ultimately, we ended up treating this patient. She was 5 years old. We ended up treating her with I think 2 milligrams of Versed, and that stopped all the seizure activity. And she became very stable after that. So, okay, again, first paragraph here now is going to be a little bit of a recap, but it's also going to be an answer to our questions. So let's just read it. Based on the information provided, the patient's symptoms, such as altered mental status, unresponsiveness, fixed gaze, seizure activity, and excessive salivation, could potentially be consistent with organophosphate poisoning. Organophosphates, and it tells you a little bit about what organophosphates are so that you can learn. They're substances that can cause overstimulation of the parasympathetic sympathetic nervous systems. We know that. Cool. Okay, second paragraph is teaching us kind of how we can diagnose organophosphate poisoning, primarily based on the signs and symptoms observed. And in the pre-hospital setting, treatment would consist of supportive care, so high flow oxygen, IV therapy, and we've got some antidotes. We know some atropine and some pralidoxime, or 2 PAM kits. And that's obviously, as we know, as this thing is telling us, to treat the wet symptoms, all the salivation, the lacrimation, defecation, all those kind of wet symptoms of organophosphate poisoning. Okay, it's important to note that the endpoint of atropine administration is the drying of the secretions and improved respiratory function, and there is no maximum dose. Okay, 2 PM should be administered as soon as possible. So this is just some really good instruction here on if we consider organophosphate poisoning. So it essentially, it says, yes, it could be. Let's take another look at the signs and symptoms. If they are definitely very wet, then yeah, let's consider treating this. Okay, and the last paragraph is just kind of a recap of, yes, the patient should be thoroughly evaluated for organophosphate poisoning, and appropriate diagnostic steps in treatment. Okay, may include the administration of the atropine and the pralidoxime, as we said before. Good. So yeah, that was not a bad scenario at all. We could have been more detailed on the 2 first prompts, but the AI handled this just fine, even though we weren't. Don't be afraid to, I guess the moral of the story of this scenario is, don't be afraid to ask this thing questions. This thing responds very well to questions. So the more questions you ask it, the better. So I think that concludes my 911 scenario. Christian, I'll hand it back to you and we can move on to the next.